Hey nursing students, imagine you're teaching a patient who just got a methadone prescription to stay opioid-free. They look nervous and ask, what should I watch out for? Do you know the priority adverse effect? Stick with me on Case Point, and we'll break this down using ADPIE to ace your NCLEX prep. Let's dive in. Welcome to Case Point. Today we're tackling a case study about methadone, a key medication for opioid abstinence. This is huge for NCLEX because it tests your ability to teach patients and spot adverse effects. We'll use the ADPIE framework, assessment, diagnosis, planning, implementation, and evaluation to guide our care and nail this scenario. Plus, we'll wrap up with NCLEX tips to boost your clinical reasoning. Ready? Let's go. First up, assessment. Your patient is starting methadone to stay opioid-free. What do you assess? Check for signs of adverse effects, especially sedation, since methadone is an opioid agonist that can slow the central nervous system. Watch for drowsiness, confusion, or slow reaction times. Also, monitor respiratory rate. Methadone can cause respiratory depression, a red flag. Check their vitals for hypotension, not hypertension, as the case study notes. Ask client about nausea, constipation, or blurred vision, since these are common too. For example, you might say, have you felt sleepy or dizzy since starting the medication? This helps catch issues early. Now, let's form a nursing diagnosis. Based on our assessment, a key concern is risk for injury related to sedation. Why? Sedation can lead to falls or impaired decision-making, especially if patient is driving or operating machinery. Another potential diagnosis is risk for ineffective breathing pattern due to possible respiratory depression. These diagnoses guide our care plan, focusing on safety and monitoring. For instance, if client reports feeling overly sleepy, we know sedation is kicking in, and we need to act. In planning, we set measurable goals. Our priority is safety. Client will remain free from injury by recognizing and reporting sedation within 24 hours. Another goal. Client will verbalize understanding of methadone's adverse effects before discharge. We also plan to prevent complications like respiratory depression by ensuring client knows to monitor their breathing. Here's where we introduce a novel term, opioid agonist. Methadone is an opioid agonist, meaning it binds to opioid receptors in the brain to reduce cravings and withdrawal symptoms. Understanding this helps you explain to client why sedation is a risk. It's mimicking opioid effects but in a controlled way. Time to act. Teach client to monitor for sedation, feeling overly sleepy or sluggish, and to report it immediately. Advise them to avoid driving or operating heavy machinery until they know how methadone affects them. Suggest fall precautions, like removing tripping hazards at home. Educate on other adverse effects. You might feel nauseous or constipated, so drink water and eat fiber-rich foods. To prevent respiratory depression, teach them to count their breaths per minute and call their provider if breathing slows. Document your teaching and client's understanding to ensure continuity of care. For example, you might say, let's practice spotting sedation signs together. How do we know our plan worked? Evaluate by checking if client can verbalize sedation signs, like saying, I'll call my doctor if I feel too sleepy. Confirm they're free from injury, no falls or accidents. Monitor their respiratory rate to ensure it's within normal limits, typically 12 to 20 breaths per minute. If client reports no adverse effects and understands the teaching, our goals are met. If sedation persists, we'd escalate to the provider for dose adjustments. Let's prep for NCLEX. When you see methadone, think sedation as the priority adverse effect, not increased appetite, hypertension, or tinnitus. Here's a clinical reasoning cue. If a patient reports drowsiness on methadone, prioritize safety interventions like fall precautions. For NCLEX-style questions, focus on the ABCs: airway, breathing, circulation. So respiratory depression is a key concern. Practice question. What's the priority nursing action for a sedated methadone patient? Hint. Ensure safety first. Check the description for more resources. Let's wrap up. We used ADPIE to teach the client about methadone, focusing on sedation as the key adverse effect. NCLEX question. A nurse is teaching a client on methadone. Which adverse effect should they monitor? A. Increased appetite. B. Hypertension. C. Sedation. D. Tinnitus. Correct answer. C. Sedation. Why? Sedation is common due to methadone's opioid agonist action, risking injury or respiratory issues. Nursing tip. Always teach patients to report sedation early to prevent falls. Subscribe and like this video. See you next time for more NCLEX hacks.